I'm the director of Common Knowledge Trust that produces the Birthing Better skills. In the early 70s, I worked with hundreds of families, and we developed these skills, mothers and fathers alike. So I know something about the skills, and I know something about back labor. The fact is that guys got this faster than women did. Birth is an exercise in plumbing. You get a big object inside, and it's got to come down through a tube, your pelvis, has to open up an aperture, your cervix, and then it has to come down into the top of a soft tissue canal, your birth canal, and then out an opening, your vagina. If that object is big relative to the space inside, or if there is tension in that space, then your baby is trying to create more room. He or she does it by pressing outward on your sacrum. And the nerves in your spine run down your sacrum. That's why you have back labor. It's not a mystery. And it is not always due to a posterior baby. And that's why one of the skills we learned is how to map your pelvis. So you find out what the space is. And you find out the shape of your sacrum and how to work with your sacrum to create more space, and how to work side to side in your pelvis, and how to work with softening the interior soft tissue of the pelvis as well. You can't always prevent back labor. In the 70s, nobody paid any attention to posterior babies at all. They barely paid attention to breech babies. That became a thing, and that really became a thing because those women who were having home births and had back labor tended to have a longer back labor. Well, why did they have a longer labor or longer back labor? And it was niggling, and it was dragging, and it was consistent, and it was persistent, and it was a drag. So it exhausted women, which meant that they then went into the hospital more often. And the reason that it persists is that baby, that big object's trying to come down through your pelvis. And your job is to create space. But we as women have taught each other the wrong things. Really, honest to God. I mean, Birthing Better Skills had to really take a look. Should we be doing Kegel exercises in the last 16 weeks of pregnancy? No. Should we be trying constantly to turn this baby? Well, why should we? Because what if the baby doesn't turn? Or what if it turns and you still have back labor? Or what if you turn it and put it into an asynclitic position instead? We worked to work on the container, our body, and to create space for this baby, this object. And we could do it. And when we manage back labor in birth, then what we did was continually created more space. And we could actually follow the descent of the baby down as to where the intensity of the pain was. And if we had done the internal work and had done it religiously, then the fact was that all the soft tissue on each side of the sacrum and the tailbone and in the big muscles on the inside of our vagina were soft and pliable, which allowed the baby to even further create more space. Did we get rid of all back labor? No, we didn't, of course not, but we managed it better. As we say on this page, if you get in hands and knees, your pain will be decreased, but the fact is the baby then comes out of the pelvis and it needs to go through the pelvis. And one of the other things that we have been teaching each other as women, which is just nuts, is to press on the sacrum, apply counter pressure. That relieves the pressure of the nerve and the intensity of the pain for the women, but what's it doing to the space for the baby inside? I mean, the common sense says it's closing the space. So you end up with longer labors. And you don't need to be in labor longer than you should be. Birthing Better skills were created by families. We put them into a charitable trust. So all proceeds from the sales go back to the trust. And they asked me, who's now 45 years later, to pass on these skills to families now so that we could really get realistic about how to prepare our body and how to cope with the birth as it unfolds.